Anxiety is an issue that we're hearing more and more about as we all juggle our busy lives. We're trying to balance our work and family responsibilities and find time to look after ourselves. So it's no wonder that anxiety is on the increase. In fact, 23% of people reported high levels of anxiety last year. But it's not always easy to recognise or understand what it is. So we're going to ask the expert, and I'm here with Bupa cognitive behavioural therapist Bianca Clarke. So Bianca, I think first of all, how do we define anxiety?
So anxiety is a very common natural human response, and it's essentially our body's way of preparing us to face a threat or danger in some way. And it can come with a range of physical symptoms. So it can make us feel quite shaky, trembly. We might notice our heart is pounding. Our thoughts might start racing 100 miles an hour. Or sometimes we find that our thoughts are just so jumbled that we just can't think straight. It might lead us to avoid certain places, certain people, over-checking things. And it can really have quite an impact on a person's life.
So lots of different ways in which it can present in different people, and physical, emotional and behaviours as well. Is it different then to feeling anxious?
Yeah, so the way I see it is that feeling anxious is something that's often temporary. It might be quite situational specific. It might be that we've got something like a driving test or an exam coming up and we feel quite anxious about that particular thing. That can be quite short term, and once that thing is over with, the anxiety starts to calm down. But when it comes to having anxiety, it might be that we find that the anxiety is more chronic, longer term, long lasting, really impacting our life and the things that we're trying to do in our daily life.
And are there different types of anxiety?
Lots of different types of anxiety. So when we think of different anxiety disorders, each different anxiety disorder tends to have a specific focus for the worry or the fear. So, for example, generalised anxiety disorder, also known as GAD for short, because it's easier to say, that's often about a range of different things. So we might worry about anything and everything. It might be things that start off quite small and they become really, really big, and it can spiral out of control. We've also got more specific types of anxiety, such as panic disorder. Panic disorder is when we fear our own physical symptoms. Anxiety comes with physical symptoms, of course, and in panic disorder, we might fear what those symptoms mean. So, for example, if my heart starts racing with anxiety, I might fear that I'm going to have a heart attack in that moment. Or if I feel dizzy, I might worry that I'm going to faint in that moment. We've got things like social anxiety, which is really common. So that's anxiety about social situations. And it might be that we fear being in situations with people that we know, or it could be people that are strangers to us, unfamiliar people. That might lead us to fear judgment from these people, or we fear that we'll be criticised in some way. And so again, it leads us to avoid people and certain places. Other really common anxiety disorders are things like health anxiety. That's when we have worries about our health or the health of our loved ones. And quite often we don't worry about things like a cold or something like that. With health anxiety, it's quite kind of the more serious, severe illnesses that we might worry about, such as cancer or heart problems. There's lots of different disorders, as you kind of have heard already. And so it's really important that if somebody is experiencing anxiety in maybe one area, that they do seek support, because there might also be other things there as well that they might be worrying about. And it might be really difficult to make sense of, what is this? Is this health anxiety? Is it panic? What is it? And so a qualified professional will be able to help you drill down, really understand it, and then learn how to manage it going forwards.
So I guess it can be quite difficult to identify. So how can we recognise anxiety, be that in ourselves or in the people that we care about?
I think with anxiety in ourselves, because we can hear our own thoughts, we might be able to recognise the worries, the type of thoughts that we're having, kind of the content of what's going on up there. And so that might be one of the first things that we notice. We might also notice physically how we feel, because again, somebody else can't feel what we're feeling, but we can feel it ourselves. So we might notice the thoughts, the physical symptoms, but also notice that we're doing things differently to accommodate for the worry and the anxiety that we have. In other people, though, we can't hear their thoughts. We don't know what they're thinking. We're not mind readers, but we might notice their behaviours much more. Right. So we might notice that, for example, they might be pacing up and down. They might be seeking reassurance a lot, asking lots of questions, even saying the worries out loud. But generally we might notice people's behaviours more, and it's important to notice in ourselves and other people so that we can again take the appropriate steps to get the right support for ourselves or others.
And it sounds like everybody's experience of anxiety can be different.
Everybody will experience a different range of symptoms. There will be some symptoms that maybe aren't so common of anxiety that a person does experience, but also different people will have different kind of intensities of those feelings. It might last for different times for people. For some people it might be much more short term. For other people it might last a lot longer. And generally the way people deal with their anxiety can be very different as well.
And thinking about the cause, what tends to be the cause or the common causes of anxiety?
Could be absolutely anything and everything. Some really common ones that I see day in, day out though are things like work stress, worries about finances, relationship difficulties and worries there, phobias, so it could be very specific things that people are afraid of that might cause anxiety. But also it could be things like the past. The things we've experienced in the past can come back in the here and now and cause us anxiety too.
Okay. Well, thank you so much for that, Bianca. That was really interesting and some really great advice there too. And remember, if you're a Bupa customer, you can head over to the My Bupa app where you'll find lots more resources such as mindfulness tools and wellbeing guides.